bag. I was so excited. Yeah.
Good rainy afternoon, everybody. Boy, it's raining cats and dogs out there today. This is Tracy Armstrong with North Pittsburgh Greeting Company, the area's premier welcome wagon lady, welcoming all the new homeowners and new businesses to the ever-growing Pittsburgh area. Today, we are talking to Dr. Missy Karski of Karski Spokane Orthodontics, located in the Seven Fields. Karski Spokane Orthodontics has been sponsoring a welcoming bag for going on 3 years now. She's a wonderful orthodontist in the area. Everybody knows her. She constantly gives back to the community and overall just has a wonderful reputation. Missy, can you tell us just a little bit about yourself for those out there who don't know who you are?
Yes, so I was actually raised in Butler County, went to Butler High School. I did my education, my undergrad at Penn State, and then I did my dental education 4 years at Pitt. And then I did 3 years of orthodontic residency at Pitt as well. And then my entire family is located around here. And my husband and I still live in the Butler area, and we're looking to move toward the Zillionople area as well. So our kids will probably go to Seneca Valley School District. So it's really nice to be local.
Yeah, Zillionople, they'll be at CVE. Wonderful school, wonderful school. Yes. So everybody, Missy is a local girl, and being as she's a local girl, she loves her community, and she wants to do well for her community and do well for children and adults and help them with all their orthodontic needs. And, we always should stick with people who are born and raised around here. So she's the lady you want to go to. And Missy, you are excited. You have a new technology at Karski Spokane, 3D technology. Tell us a little bit about that.
Yeah, so we're really excited. We're going to be talking a lot more about this on our social media pages up and coming. But so we have what's called digital scanners, and we've had these for a while. A lot of patients use these for Invisalign. A lot of practices use them for Invisalign. So instead of impressions and all that goopy material we used to put in our mouths, we can now use a scanner, an intraoral scanner. And it's basically just a little camera, a little wand that goes over the teeth, and it develops a model on our computer screen. And it creates a digital file that we can send to Invisalign to have aligners made. But what our newest purchase is a 3D printer. So we actually invested in a 3D printer. So now for any appliance we make, including expanders, retainers, some just aligners to move the teeth, everything we do now, we can use that intraoral scanner. So no one has to worry about the impressions anymore, which I know even for myself, when I had braces, I never wanted to get those impressions. They get
you.
Yes, they definitely get me. So we're completely eliminating the impressions, which is great. We can print the 3D models in our office and have all of our appliances made. And another great thing is what we're using them for is we actually have a software program where, say, a person comes in and they only have maybe one tooth that rotated a little bit, or just one tooth that's not perfect, and everything else is great. And so we really don't need a full set of braces or even a full Invisalign treatment. We maybe just need to move one tooth, and we can actually use our software and this 3D technology to make a couple aligners, maybe 2 or 3, just to get that one tooth back into place. And it makes it so much more affordable to pass on to our patients, which is great. Invisalign is wonderful. We love it, and we do a ton of it. But for those very small movements, we can do something a little bit more affordable and a little bit quicker as well.
And this 3D technology can be used on adolescents and adults as well, correct?
Yep, absolutely. So a lot of times, especially our younger ones, one of their fears are the impressions. So at our consultation, if we recommend treatment, say they would need some type of appliance, whether that be an expander or some type of functional appliance, we used to take an impression at that visit. Now we simply do a little scan, and it's all complimentary. So during their consultation and their records, we do all of that complimentary, which is nice. And then they don't have to worry about those impressions at all.
Now, I know a lot of parents out there, we talked about this prior, a lot of parents out there are going to ask, does insurance cover this? Is this part of your payment plan? Do some insurance cover 3D, others do not? Can you tell us a little bit about that? Because I know, orthodontic work, some people are blessed to have it covered at 100%. Other people are blessed to have it 50%. Others, they don't have any orthodontic work. So obviously, money is a factor. It is.
Sure.
So
Yes.
can you tell us a little bit more about your 3D and insurance and whatnot?
Absolutely. So, no matter what, any patient that comes in for a consultation, like I said, that's complimentary. Oftentimes, we do the records at that visit. When I say records, that means the scanning, photographs, that sort of thing. And we do that on our patients if we recommend treatment. Even if they decide not to pursue it, that's still complimentary. There really is
Okay.
no fee. The only time there would be a fee would be when they actually begin treatment and something goes in their mouth, and that is when insurance can come into play. But as far as covering 3D or not, that's just considered records, and it
Okay.
really doesn't make a difference whether we do impressions or scan.
Oh, wait. Well, that would be on the top of a lot of parents' minds. That really would. And what other services do you offer? You do braces, you do Invisalign, any other services that you offer?
So, a lot of our patients do come in for TMJ consultations.
Mm-hmm.
They have pain in their jaw areas, headaches, popping, clicking. Sometimes we do splints to correct that. Sometimes it can be an actual bite issue that we do recommend some orthodontic treatment. So, TMJ is often why patients come in. But yes, braces, Invisalign, we do clear braces. We're correcting a lot of dental facial issues. So, we do orthognathic surgery sometimes if a patient has a very big underbite or a big overbite, cross bites, that sort of thing. But day in, day out, typically we're mostly just doing some Invisalign and braces to correct alignment, aesthetics, and more importantly, function, just to make sure that our patients finish with a functional and proper bite in the end.
And when, we might have some parents out there of younger children, 4, 5, 6, 7, 8. When do you think, as a parent, would be a best time to say, now is the time. I'm concerned about my child's teeth. I'm concerned about the growth. When is the time for a parent to pick up the phone and call and make a consultation with Karski Spokane Orthodontics?
That's a great question. Now, the American Association of Orthodontists does recommend around the age of 7
Mhm.
to come in for at least a consultation. Again, that doesn't mean we need to do anything. At that time, we usually take what's called a panoramic x-ray. We check
Mhm.
spacing, make sure we don't have any extra teeth, missing teeth. We make sure the permanent teeth have room to come in, and we check for any bite discrepancies. So 7 is a good age. There are 2 bites. I know I mentioned this before, but an underbite, when the bottom jaw is further forward, or a crossbite. Those are the 2 times. Sometimes we actually do see them a little earlier, 5 or 6 sometimes even, just to maybe do some skeletal changes. So not
Okay.
necessarily braces at that age, but it would be more just a functional change if we need to correct the skeleton. So 5 or 6 for just those 2 bites. Otherwise, 7 or 8 is a good age.
And there is no bad age to start orthodontic work. Am I correct?
No, not at all. We have, little ones all the way up. I have, 70, 80-year-olds. I mean, we have everybody. It doesn't matter what age. We can always do something, most as long as periodontally and dentally they're healthy. We can do it.
And if somebody's interested in making an appointment with you, again, everybody, Karski Spokane Orthodontics is located on 228 right as you go into the Seven Fields area, basically across from North Catholic High School, give or take. But that's basically
Yep.
where Dr. Karski is located. Can you please give us your website?
Yes, so it is www.karskispokaneortho.com. And our phone
And
number is, oh, go ahead.
no, please.
I was going to say 724-591-5758. That's our phone
And
number.
can somebody make an appointment via your website?
Yes, yes. You can go on there and click schedule, and that will direct you on how to schedule.
And do you have any COVID-19 restrictions going on in your office now that you would like people to know about?
We still have limited waiting room access. We still require you to wear a mask when you come in. We do have you fill out a questionnaire. We do hand washing, and a little mouth rinse prior to seeing our patients. We also do temperature taking. So
And
those would still be.
and our parents, I mean, I know some orthodontics, I mean, some kids are older, it's okay for them, they're okay to go in without a parent. Are parents allowed to, one parent, I'm sure it's just one parent, you have to limit that, unfortunately, right now. Are parents still allowed to come in with their children?
Yeah, so we definitely, I mean, as long as if someone's maybe a little nervous, maybe it's their definitely first time in the office, we always recommend a parent come in. But yes, you're welcome to come back. We take your temperature as well, and as
Sure.
long as it's not too overwhelming in the clinic area, and if it is, we can always just hold off a little and make sure you can come back with your child if you need to.
Well, Dr. Missy Karski, thank you so much for taking up your time today. I do want to stress again, everybody, Dr. Karski is a local resident. Again, like you said, she graduated from Butler High School. I know her. She has 3 beautiful children that she is raising here in this area. She does give back. You can see Dr. Karski's advertisements on the back of t-shirts for local baseball teams, soccer teams. She's that doctor who advertises in the local bulletins and gives money back to local sports teams, organizations, whatnot. So she is very much part of the Southern Butler County community. She does give back to the community, and I think that is very important for businesses to give back to the community because it makes the community prosper. And it's so wonderful that you do that. And I think that's very
Thank
important to
you.
people to know that
Yes.
you do give back to the community.
Absolutely. If anyone ever is looking for sponsorships, anything we can do, we're more than happy
I
to
know,
help.
and you and your office staff are beyond generous with that,
Thank
and I think that's
you.
very important when picking an orthodontist. Not only that you're a great doctor, you're a great orthodontist, but you're a great citizen of our local community, and that's
Thank you.
very important for people to choose. So everybody, if you're interested in having a consultation, it doesn't matter if your child's 7 or if you're a grandmother and you're watching this. I've
That's
always
right.
wanted to fix that too. Dr. Missy Karski can help you with that. After this interview, we are going to post to her website. So if you're interested in learning more about her or having a consultation, you can simply click onto her website from this interview and schedule an appointment. Dr. Missy Karski, it was a pleasure speaking with you today on this rainy day. Hopefully it's
Yes.
nicer tomorrow.
I
And
hope so. Yes.
Yes, and I appreciate it, Doctor. And again, everybody, this is Tracy Armstrong, the Welcome Wagon Lady, and we are the key to making the first impression. Thank you so much.
Thank you, Tracy.
Thank you.